Hi, everyone, and welcome to Living Well with Dr. John, Adjustment Through the Lifespan. Today's topic is anxiety. Before we begin, I'm going to share two webinar disclaimers. The first is, this is for educational purposes only. For psychological services, please contact your state psychological association for referral. The second disclaimer is, the questions, comments, and opinions expressed during this webinar may not express the views and beliefs of the Christopher and Dana Reeve Foundation. Now for some background on Dr. John. Dr. John Chang is a clinical psychologist and is board certified in rehabilitation psychology. He's a professor of psychology at East Stroudsburg University, as well as a consulting psychologist. Dr. Chang also has a private practice through Doctors on Demand. Two quick notes before we start. Today's webinar is being recorded and will be available on the Reeve Foundation YouTube channel. Additionally, if you would like to ask Dr. John a question, please use the Q&A box also located at the bottom of your screen. Now I'm going to turn it over to Dr. John. Hi, Dr. John.
Hey, Kaylee, thank you for the intro. Thank you once again for helping me put this podcast together. I sound like a broken wheel, but I always start my intro with thanking both Kaylee and Angela from the Christopher Reeve Foundation in supporting this podcast and allow me to come on air with you once a month and with creative topics for quality life and individuals with spinal cord injury. So today I'm going to talk about the topic of anxiety and how that impacts individuals with spinal cord injury and also how that impacts quality of life. You know, prior to today's session, I was going through my anxiety rituals. I think, you know, anxiety is the number one mental health diagnosis in general. General population, about 19%, 20% of us in the United States. So it's a highly prevalent diagnosis, and I can understand. So prior to this podcast, I kept doing my deep breathing, you know, and just trying to relax my body. I was challenging my thoughts in my head, you know, because the first thing you think about when you do these presentations, and so for those who are here who are taking classes or having to do class presentations, you know, there's that anxiety that comes up, and you think you have these negative thoughts in your head. It's like, oh, I'm going to screw this up. I'm going to look like a jerk. Everybody's going to see that I don't know what I'm talking about. So all these negative thoughts come through your head. And so the first thing you think is like, okay, I am not that stupid. I'm qualified to talk. And so you have to fight these automatic thoughts that come to your head when you are working against anxiety. So there's that physiological response of lightheadedness and difficult breathing and feeling like you can't catch your breath. And so I was just like, okay, take a deep breath. And then the other thing was, okay, I'm qualified to do this. I've been teaching for 25 years. I've been a professor for as many. And, you know, so I'm just going to do the best I can. The last thing I tend to do before I get on to present or to do a speech is that I have to say something that's calming in my head. So I teach my clients to say, okay, what do you have that can ground you? What is one phrase that can put you back into ease? And I know some of you may laugh at this one, but I always say to myself, okay, no matter how much I screw up today, my mother will always love me. So that's what I say. I say, okay, even if I mess up, mom will always love me. And that is true, right? Mom will love you no matter what you do. So by saying that those are some of those techniques, and I'll talk more about that at the end. So what I'd like to do today is to give you some statistics, talk about the different type of anxiety, because knowing the type of anxiety Now that applies for both if you're able-bodied or if you are an individual with spinal cord injury. Being diagnosed with the right type of anxiety is really crucial because the treatment for each is slightly different. So I'm going to talk a little statistics, talk a little bit about the type of anxiety, and then apply to a little bit of, or some of the clients and cases I have out there. And I'll go into some questions. There's, pre-registration, I always get a bunch of questions that I'd like to answer. And if you have any, and those of you who are listening right now, if you have any questions for me that I haven't brought up, or that that you thought during this talk, please send it to Kaylee. She'll interrupt me towards the end, and hopefully I can answer some of those questions. Ultimately, I want to make this podcast interesting and lively. And since you're willing to spend an hour with me, I'm hoping I can give you some education and some entertainment. So as stated, general population is about 19%. And children between 3 to 17, some literature has shown that individuals that's 3 to 17 years old, it's about 7% of the population. If you get older, over 65, that goes down about to 60 to 20%. So why does anxiety go down as you get older? Well, I'm going to have to say probably wisdom. I'm going to say that as you've lived through life, you probably have seen a lot of horror and pain, and you have managed to live through those things. Things don't seem to bother elderly as much. So I'm going to call that wisdom, just life experience. But after a spinal cord injury, that number definitely goes up. The literature has shown that it's approximately between 30 to 45%, depends on what you read. So now we're getting to a level of 1/3 to almost 1/2 of everyone who's had spinal cord injury may have experienced some sort of anxiety diagnosis. What's been happening with anxiety now? One of the things I know is that in my private practice on Doctors on Demand, where I have privileges in 22 states in the country, the demand for mental health during this pandemic has skyrocketed. Yes, it in general, with or without disability, we're all jacked up. We are all more anxious than ever because how this pandemic has affected us. We sequester us in our house. We're not allowed to go out, and that's one of the main things I talk about, how anxiety has really impacted me. Not only has my quality of life, I believe, has decreased over the last few years, my anxiety has increased because of the pandemic, specifically caregivers. In the beginning, when everyone was going crazy about how does this thing pass, can you touch, can it be transferred through grocery shopping? My God, you didn't know if you should go out to go grocery shopping. If you're not, if you do, you had to spray everything that came into the house. So that overall anxiety, general anxiety, has significantly increased in myself. And then with the issue of caregivers, I mean, the fact that you are at home, supposed to be being a sequester so that you're not near anybody, but yet your caregivers come into your house every day. Now, how does that work? See, my caregiver has a family, and in that household, they have individuals who worked, so they go out. So not only was I impacted at home with just who I was around. I was impacted by the caregivers, and then I was impacted by their caregivers' other relationship. And then holidays came where they had get-togethers, which therefore means whatever they got to get together, it was going to impact me. It was just such a constant frustration and vulnerability. Oh my God, is someone's going to come? Is someone's going to come sick? So that was one part of my anxiety, the fear that I was going to get sick. And as you and I know, being a person with a spinal cord injury, respiratory and sepsis are like our number one killers for ourselves. I was fortunate enough to be able to teach from home. I didn't go into the school because I didn't want to be around people. Even though at this point at the university, they're all back at this fall, I still stayed out this fall just because I wasn't quite sure about this Delta variant. So the caregivers was an issue. The anxiety, I was revved up. I can tell my body had greater spasticity. I had higher frequency of nausea, headaches at times. And those are some of the physical symptoms that we tend to get when we get anxious. Going out, unfortunately, being a C5 quadriplegic complete, there's a lot I can do, and I've done some of those things, as much as I can. A few months ago, I went down to Annapolis, Maryland, and did some sailing. I've done, skiing in the past, but in general, I don't really get to do a lot. Those are sort of like once in a great while type things. So, but one of the things I do love to do, unfortunately, is go out to eat. I love going out and eating. I mean, I'm not saying I have to go out to somewhere fancy. Trust me, I don't ever go to somewhere that's a nice dining. I just like to get out and eat somewhere, even if it's fatty, greasy fried chicken from somebody, Popeye's chicken or something. But so being a quadriplegic, I love to eat, and that's probably not a good combination because we have to really watch our weight, and you should see my stomach sometimes. But the pandemic threw that out the door because you really couldn't go out to eat freely. So everything I love to do, everything that people were coming in was creating anxiety. And what do you do with that? What do you do? How do you manage and can continue to be productive? When is anxiety too much? And first of all, give me a shout out if you love to go out and eat. Those who are listening right now, give me a shout out to let me know you like going out to eat like I do, so that I don't feel like I'm the only one that loves to go out to eat. But so how do you know what is anxiety to a point that you need help? And if you do need help, what is the best treatment for help? So let me give you a couple of more examples of anxiety in the cases, and then I'll go into some practicality of how it's diagnosed and then how to treat it. Okay, so I had a patient in Texas, young lady, about 25, and her anxiety was displaced through, she tended to pull her hair. So it didn't matter if you're a quad, maybe you can't pull your hair, but she pulled her hair. We call that Trichotillomania. And she became incredibly, her skin on her chest, her ears got really red, the vasodilation of her body. You could tell when she got anxious. And she also said to me, she said, look, I have a meeting with my supervisor today. But I know right before I go in to talk to her, I'm going to start freaking out. So that was, so what do you do with that? Is pulling your hair, is the redness on your face enough to be treated for medication or therapy? What do you think? What do you think, listeners? Would you go for treatment with those symptoms? Let me know your thoughts. You think yes or no? Yes, that should be enough to be treated, or no, that should be something they could handle. You should be able to handle on your own. Okay. Many people are saying, yeah, that's, and well, and the panelists, you are correct. With the ones that said yes, because, and that's why it was interfering with her life. And that's the key. If the anxiety is to a point where it interferes with your life, if you're a student and you can't get up and do that presentation, even though you know the material and you should get an A, but getting an A on a presentation is not about I know the material. It's about I know the material and still going up there and doing a presentation well. And you can't do that. Yes, you should be in treatment. And I have another case, and I'm bringing these cases because I want you to realize how some of these things are very common, and some of these could be very unique. I have a gentleman friend that is trying to transition out into independent living facility. But the current place that he's at, he's not allowed to smoke his medical marijuana, or he's not allowed to smoke marijuana in general. Some type of rule for this building. It's funded by the federal government, or so. So it's not really state run, or state has other influences. So he's not allowed to use his medical marijuana. So he developed a lot of headaches. He has higher rates of pain. And so the goal for me, it was to find another way to cope with his current situation, his anxiety, until hopefully he can move out to the independent living facility. So those are some examples. I mean, I for myself is example number one. I had to fight my natural body response, my anxiety of talking in front of you. I'm a perfectionist. I want to come out of these podcasts like, okay, I did a good job for my listeners. They learned something. They want to hear from me. And so that creates a lot of anxiety. The other two clients I just indicated, well, they had their unique specific reason. I bet those of you who are listening right now have your own unique things that causes you to be anxious. So, okay. So let me talk about what anxieties are out there. Okay. So we have a quick little poll. Has your anxiety increased after you were injured? Now, these are pertaining to the people who are spinal cord injured after injured. Has the injury caused you to feel less control in your life? And that's a big factor. Control. Are you in control of your life? That's one of the foundation of anxiety. Control. Do you have control of your thoughts? Do you have control of your body? And do you have control of your life in general? So let's see, 71%, okay, of individuals indicated a yes. And it definitely, I'd be one of those 71% of individuals who say that anxiety has definitely increased, especially with the pandemic. So let's talk a little bit about the type of different anxieties that are out there. Okay, I briefly mentioned the first one, the generalized anxiety disorder, we call that GAD. How do you know you have GAD? GAD are individuals who have nothing specific to, like today I can say, look, I'm anxious about the podcast. That's a specific thing. But in general, GADs are people who are neurologically just revved up. I use the metaphor that these are individuals who feel like they're sitting on this edge of a cliff, and at any time, someone can push you off. That's literally, you're almost on the edge of a cliff all day, every day. And you have no idea why you feel this way, other than the fact that you're always revved up and you're always nervous. And we call that generalized anxiety disorder, which is very different than specific phobias. Like a specific phobia would be something like your fear of public speaking, your fear of arachnophobia, phobias of anyone here afraid of spiders? Okay. Anyone here afraid of clowns? I had kids in my classes, they are fearful of clowns, which I was always thought that was funny. How about anyone here afraid of heights? Okay. Anyone that hate going up those ladders or elevators? Okay. So let me know if you're afraid of heights, spiders, clowns. Okay. Now, so that's a specific phobia, which is very different treatment than generalized anxiety. So now I'm going to go back to you being a person with a spinal cord injury. You still can have all these different type of disorders, even though you're in a wheelchair. It does not change. The body changed. We are paralyzed, but our mind didn't change. So if you had a phobia of spiders before your injury, and now you have after your injury, I guarantee you that phobia is still there, because it's even harder to get away from those spiders. Now, I'm going to have to tell you one phobia that I did hear in my class from my kids, and you tell me if you ever been phobic of this thing. I had an individual that was phobic of ketchup. Yes, ketchup. Now, I don't know how she developed this phobia, but somehow this ketchup was extremely fearful for her. And the other odd one I've heard before also was fearful of cotton balls. Yes, cotton balls. Again, I've yet to see a cotton ball attack anybody, but this person didn't like, I'm going to say she probably didn't like the texture, the feel of the cotton ball. So, so yeah. So, her friends would say people would leave cotton balls on her desk or ketchup around them to get them to. And that's the beauty of friends. If they know you have one of these fears, I guarantee you they're going to pick on you about that. So, so that is specific phobia. I talk about generalized anxiety. There is also OCD, obsessive-compulsive disorder. Now, again, very different. I have an upset, if you think of people who have to wash their hands, people who have to close their door. Let me tell you of a story of a friend of mine who had OCD. We drove up to pick her up one day, and we always have to get there half an hour earlier than when we want to pick her up, because this individual would come out, close the door, come out to the car, and then they have to go back to the door, check the door, make sure it's locked, and then come back out to the car. And then she would have to go back to the door and check the door, make sure. She had to check the door at least 25 times to make sure it was locked. And there was nothing we could do at the time to tell her, let's go, keep going, because now that's sort of like an extreme of an OCD, the potential hand washing all the time. But I have heard students to say, when I get out of my car, I have to check and make sure all 4 doors are locked 2 or 3 times. Nothing significant, but just enough just to feel like I got double check to make sure all the doors are locked a few times. So that's like the limited version of the extreme. So any one of you have any OCD type behaviors? For me, I think my only OCD is like, I don't like seeing pictures crooked. So I always like to make sure they're nice and square off. I have heard many students have like to color code their clothing, their drawers are colored, everything's aligned a certain way. So, so any color, any type of OCD behavior out there for you. So I talked about specific phobia, clowns. I talked about generalized anxiety disorder, which is just, I feel anxious. I talk about obsessive-compulsive disorder, which is you got the thought and the action. You have the thought that your hands are dirty, and therefore I have to wash it. Those two combinations, in theory, reduces your anxiety. And the last one that's probably the more common is social phobia. This fear of other people's judgment of you. So, actually, I just 2 more: social phobia and panic disorders. I have a patient, and she's a 55-year-old white female down in Tennessee, and she can't get out. She can't get out the house. If she walk out the house, she will start hyperventilating. Heart will start pounding, and so she doesn't like to go out the house. She'll stay in it. And with the funny part about the pandemic, it has made things a little easier for her so that she doesn't have to go out. So because you got people delivering your groceries to you now. So you can see doctors online now. So there's no reason for her to leave, which in some ways has made her anxiety, her social phobia, agoraphobia, which is fear of going out with panic attacks, even worse. Her only socialization at this point is her family, which they go to her house, and me. Now, this individual suffers significantly from another anxiety disorder, which is PTSD. Individuals with spinal cord injury may also have PTSD, specifically with the injury and the accident. Now, I had my accident out in the ocean, and surprisingly, I still like going to the beach and looking at the ocean. In the first few years, I avoided going to the ocean, but after a while, I finally realized how beautiful the ocean is. So I actually enjoy seeing the water in the ocean. But many individuals who have had a significant accident may be traumatized by the motor vehicle if they had that, gunshots, loud noises. So these are the type of different potential anxieties. Or underlying all these is control, the inability to feel like you're in control of everything. Okay, and that's one thing I always tell my clients. Well, we'll talk more about control what you can control. So if we can put that table up, Kaylee, and why do I want to talk about all these different types of anxiety? So Katie's going to put up, if you look at the medications, and some people are going to say, should I be taking medications with this? And I'm going to say to you, the best treatment for anxiety and mental health disorders is the combination of therapy with medication. If you want the fastest result, usually it's the combination of both. Okay. Although medication by itself sometimes don't treat the core issue, and the other part is if you have therapy, sometimes it takes a while before you feel any relief. But just looking at this table itself, there's a whole bunch of SSRIs and benzodiazepines, different type of medications for different type. And what I just want to point out, obviously I'm not going to ask you to memorize any of these because I don't need to memorize. But what I want to show you is that different disorders can match up to different types of medications. So, having, looks like, for example, Paxil. Paxil is a very common medication. It's very good for most of these disorders, as well as Prozac, which has like OCD and PTSD. Let's see, sertraline is a Zoloft. Now, again, Zoloft has all these number ones, can be good for it. But a number 2 or 3 just means that the research data has not proven that's really good, as good as the number ones. So just different types of medications can be geared to a certain type of disorders, as in PTSDs or GADs. When you look at GADs, you're looking at, well, maybe Paxil and venlafaxine. I think that's Effexor. Those are good medicine. Now, the benzos, the Valiums, the Ativans, down in table 2, they will calm you down. They do work. However, they have long addictive processes. So you really want to talk to your doctor when you start taking those. And obviously, being biased, I'm a therapist. So here are different type of therapy. The therapy that probably the best therapy treatment for most anxiety is what we call CBT, cognitive behavioral therapy. If you look at that, it has running all down panic disorder specific. Relaxation for panic disorders is not that efficacious. Okay, OCD, cognitive therapy for OCD doesn't work well. Okay, the best is behavioral therapy for OCD type symptoms. So knowing partially what kind of treatment you're getting for the type of disorder is critical in your success. So that's the only reason I wanted to show you that medication is good, therapy is good, the combination of both is even better, but there's a lot of different medications out there that's available. When I did a quick survey of treatments for anxiety on my groups in Facebook, my spinal cord groups in Facebook, I'm going to show you a lot of different types of coping skills, but many individuals was promoting their prescribed medical marijuana. Foundation doesn't indicate that they advocate for that or not. I'm not saying that works for not or not. What I'm saying is that in the Facebook, between all the medications, what I saw is that many individuals say that they're on medication. A lot of them are on antidepressants for the anxiety. Some mention about these Valiums and Bendos, and they say these shouldn't be on there very long. And some people also mentioned that they were on medical marijuana as well. So again, I'm not saying that I support that. You need to talk to your medical doctor and your therapist about what is the best treatment for you. Okay. All right. Let's talk about some practical ways. And this was also pretty evident in, so first of all, treatment. Let me reiterate. Cognitive behavioral therapy. Cognitive behavioral therapy means you talk about your automatic thoughts. Okay, like for example, one of the things I always tell my patient is the monster that you create is bigger than what it is. Again, the monster that you create is big. So there's 2 things I tell my patients: control what you can control, and the monster you create is always bigger than what it is. So whatever you're thinking, it's not that bad. And if you're thinking about something you can't control, like if I'm worried about the weather tomorrow, well, why should you? Because there's nothing you can do about it. If it rains, you got to get an umbrella. If it doesn't, you don't have to deal with it. It's a moot point about worrying about the weather, because it will come no matter what you do. So you just have to be prepared for either one, right? So what are some practical suggestions? Well, limit alcohol, caffeine. Okay, that's a tough one. Any one of you on this panel drink like those Red Bull or Monster? Let me know if you did, because that probably jacks you up on a lot. I mean, it reminds me of in the 80s when I was in college of no-dos. You know, they actually gave you caffeinated little pills that you can take. So it's the same thing. Taking a deep breath, counting 10. Absolutely. Before I got into today's podcast, I said, okay, you know, that there's a professor called Lazarus out in Berkeley. He said there's two types of coping. There's the emotion-focused coping and there's the problem-focused coping. Emotion-focused coping is you can't change the issue. You just got to change how your body reacts. And part of that is just taking a deep breath and just try to let the anxiety go. Meditate, yoga. That's an emotion focus. That's you relaxing your body, irrelevant if you can do anything out there. Okay. Taking time out. Yes, absolutely. Strangely, you know, what I do sometimes is I let my dogs out to go bathroom. It's a weird way to take a time out, but it takes me away from my desk. I go outside, I take the dogs out, I tell them to do their business. I'm out there for only a few minutes, but it's taking just a few minutes just to relax and out of my normal structure. Okay. Eating a balanced meal, you know, that is so really crucial. Your diet and how well you eat is really critical. For someone like us with spinal cord injury, having that good bowel routine and having the ability to go regularly is incredibly soothing and calming. I mean, if I know if I had my good routine that day, it does impact how I feel the rest of the day. So eating a lot of vegetables, taking your Metamucil, you know, doing these things, drinking a lot of water makes a lot of sense for people with disabilities. I mean, makes a lot of sense for people in general, okay, here's the one I struggle with. It says, do the best you can. See, instead of aiming for perfection, which is impossible, be proud of however close you get. I am a perfectionist. I want to do well in everything I did. I was just telling Kaylee the other day, you know, I'm taking a class right now and haven't been in class, you know, I haven't been a student for 25. I mean, I've been taking little quizzes here and there for continuing education, but I have not taken an actual class. But of course, you and I know I want to get 100 on my test. And that creates a lot more anxiety than you need to. So getting involved. People with spinal cord injury should always get involved with other people with spinal cord injury. That is like, especially right after the accident. It's been said again and again, social support with individuals who are similar. I joined a rugby team for Philadelphia when I came out of the accident. I found myself with close friends that I'm still in contact with. Social support and getting involved with others, people with disabilities is critical in your survival and the quality of life. I've learned so much from others who now I'm 35 years post-injury, so it's a long time, but there's always someone ahead of you that figured it out before. So I never want to reinvent the wheel. Learn what triggers your anxiety. Now that takes a little time. Maybe you need to be in therapy to figure that one out, because sometimes you don't know exactly what bothers you, consciously or unconsciously. And so go to therapy, do some journaling, try and find some way, see a therapist. Now, it's really, those of you who've been in therapy had some good experiences and bad experiences. You have to remember, a therapist you must like. If you don't like the person, your therapy is not going to go well. So it's not like a medical doctor. Sometimes they're really good at what they do, but they just have horrible bedside manner. But you still stick with them because they know what they're doing. Like a surgeon, if someone's going to do surgery on you, I'm more concerned about if their hands are, if they're good at what they do, than less of, how nice they are. But if you're a therapist, you need to find someone that you really like, and so that's important. Again, talk to someone. Humor, a good laugh goes a long way. Absolutely. If I can't find a way to make you laugh for a few minutes here, I have to say that is one of the best ways to distract your brain. I was just watching Seinfeld. I used to catch Seinfeld a little bit here and there, but now with streaming, you can watch anything. So I was just watching Seinfeld the other night, and my God, that is such a great show. Those of you, and let me know if you're a big Seinfeld fan, but I was just like, wow, they're basically about a show about nothing. And that is so true. They talk about everything, but they really don't have a direction. And so that was funny. So I gave some tips on some ways. Exercise, if you're able to. As a quadriplegic myself, it's hard for me to exercise. But I know there are a lot of different types of machines out there. I'm always envious of the pairs. Pairs always, man, they're just amazing. When they have their upper body and just a wheelchair, they do incredible things. And so I always get envious of what they can do and what they can. So exercise, taking time out. So those are some practical ideas. If you have some suggestions of how you manage your anxiety, please post it on the chat and give us some of your suggestions about what you do to manage your anxiety. So coping, yes. Did you have to change the way you cope after you became injured? Has your injury impacted the way you cope? And so the question is, just having the injury itself, did you have to change a little bit of how you manage the stress? Okay. I am going to pull up my Excel spreadsheet to try to answer some of these questions that were addressed today. Let's see. And the answer is yes, 64% had to find new ways to manage. And that makes so much sense to me. I think some of our things that for anxiety is universal. Exercising, absolutely. Any way you can get your heart going and get those endorphins moving. Not many of you might know that before my accident of age 19, I was a state champ in powerlifting. So I used to love to work out. And if I did go a day or two without exercising and lifting, I would literally go through that withdrawal symptoms of that natural endorphins that my body would make when I exercise. So exercising is a natural pain killer. Okay. And it plus I like having a six-pack. I tell my wife I have a keg now instead of a six-pack because how round my belly is. So it's no longer a six-pack, it's a true keg. So let me see. So I am going to see some of these questions I might have already answered in the process of going through the lecture. So one question from Caroline, and Caroline in Pennsylvania says, those who have suffered anxiety pre-pandemic may be experiencing more social anxiety. But now some places are coming back up. What are some steps for those with social anxiety could take to limit panic when going out for groceries? Well, the question is, how much do you want to go out, and how much do you, it's easy just get someone to deliver your groceries. I see my neighbors do it, we do it. periodically. So that compensates for it. But if you're saying, look, I still want to get out there and be with someone, well, my suggestion is control what you can control. I put the mask on. I disinfect my hand on when I get back into the car. I focus on the things I can control. Okay. Go to the grocery store when there's not a lot of people at the time. You're not going after work where most people shop, or on the weekends, you go there in the middle of the day when there are less people. So control what you can control on that. Let's see, Shanna Kay from Pennsylvania, she says, what are some treatment options for anxieties that doesn't involve drugs? And we talked about, in the beginning, I said, well, there are some antidepressants and some benzodiazepines that are available. However, things like taking a time out, limiting alcohol, count to 10, taking a deep breath, finding a way, meditate, yoga. I think those are great non-drug related ways to. And if you look at this literature on that, for long-term, medication is probably not the best result. It's the changing of your thoughts and behaviors for if you wanted to treat it for the long term. Okay. Here's a good one, which I just downloaded a book about this. What is the best way to cope with anxiety at night when you can't fall asleep? I don't think there's enough being said out there about sleep. Now, I'm going to take a brief survey. How many of you here had difficulty sleeping at night? Just in general, yes, no. Okay, so how many of you have lots of, okay. Now, those of you who aren't familiar with spinal cord injury, or those of you who are, being a quadriplegic or person with disability, we have a lot of different things that are impacting our sleep. It could be as difficult as having to be turned every 2 hours to avoid pressure sores, to have all these bags and leg bags and night bags hanging everywhere. Difficulty for me, it's just a simple fact of adjusting my temperature. Since I don't regulate my temperature very well, if I have too many blankets on, I'm too hot at times at night. If I have if I'm not covered up, I'm freezing because we don't shiver. So sleep is a huge factor. And I think people with spinal cord injury even have more difficulty with sleeping well. So I would say, look, don't drink too much before you go to bed, because getting up in the middle of the night for many people without disabilities is an issue. Small bladder. Don't drink caffeine before 4 o'clock in the afternoon. By the afternoon, you should not be drinking caffeine. They tell you to go to bed at the same time all the time. No matter what you do, go to bed at the same time. Your body starts to adjust to a certain schedule, and that's critical. They also said there's only 2 things you should be doing in bed. Do anyone know what they are? You should only do 2 things in bed, and that's it. So that your body realizes that when you lay on that mattress, you're only going to be doing 2 things. They're sort of slightly opposite of when it comes to arousal, but what do you think they are, group? Well, one's sleep, and what's the other one? Sex. You're right, sleep and sex. So if you only do sleep and sex in bed, and don't watch TV, don't read your book. If you're going to watch TV or read your book, do it out in a chair on the side of the bed, do it somewhere else, but don't do anything other than sleep and sex, and go to bed at the same time and do a couple of those other things. You will improve your sleep hygiene. And if you just do that and sleep well, I guarantee you there's less depression, less anxiety, better quality life. People just don't get enough sleep in these days. and at least 8 hours. So, so that's a great question. Let's see. So here's a question definitely from a student, Susan from New Jersey. What's the best way to handle anxiety before and during an exam? Well, before and during exam. Well, being a professor for 25 years, this is a great question. And I'm going to say the best way to handle anxiety is to study. My kids don't study enough, so study. But there are a couple of things, obviously being prepared is one of the hardest and the easiest way to solve anxiety. If you know the material, you're not going to be. But some people have these things called what we call pre-anxiety jitters, and they end up having so much anxiety they don't do well, not because they don't know the material, but because the anxiety gets in the way. So you need to practice you're taking the exam. We're in whatever room you're in. You need to practice those tests. A lot of times they have those practice tests that you can take so that you're aware of some of these. So practice when it comes to exams. I have one sort on a side note here. It's anxiety, but yet it's a question from Tamilda. And Tamilda said, I know I'm pronouncing you wrong. I apologize. How can I achieve my goals in academics as a quadriplegic? That's a great question. I'm going to say sacrifice. You need, if academics is the way for you to have a better quality of life, I'm going to say you're going to have to give up a lot of things while you're in school to achieve, because everything's going to take you twice as long being a person with a disability, from flipping the page to typing to getting to the classes. So you need to persevere, sacrifice, ultimately get your degree, and it will be a benefit. I knew early on with my injury that I had to get some form of career that I could get paid, that's going to fulfill my medical needs and my financial concerns. I knew that if I sacrificed 10 years of my life from when I was 20 to about 30, that the rest of my life I will be in the position of feeling better about my career. And I did. I've been very fortunate. So that's motivation, sacrifice, and willingness to give up a lot of things when you're younger in hopes of having a better thing. And so even if you're not a person with a spinal cord injury, it makes it's the same obligation and the same type of sacrifice. So if I had to give you any suggestions about that, is to find a way to work on something that you truly want to do, committed to it, because with that sacrifice requires a lot of motivation. And when you're in the trenches and everything's going wrong and you got a million tests, you're find yourself, why am I doing this? So Kaylee, do you have any questions that come up through today's chat before I keep going, or did I cover most of them?
Hi, Dr. John. We have a few questions that I think we have time to answer. The first one I see is, how do you get over speech anxiety?
I'm sorry?
The first question in the Q&A is, how do you get over speech anxiety?
So I'm assuming when you say speech anxiety, that's more public speaking. And if it's public speaking, it's like anything. One of the biggest fears about being in a wheelchair is that everybody's looking at us. Everybody is judging us. And everybody is critical of what I'm saying, what I'm doing, how, and the reality of that one is it's probably smaller than what you think. You're probably creating, as I said it, the monster you create is always bigger than what it. So probably most people don't care what you're doing, to be honest. Most people aren't even paying attention to what you're thinking half the time. Now, when you go in front of a classroom, your eyes are on you, and that's sort of hard to get around. But most of them really aren't judging you. They're probably saying, geez, I'm nervous when I have to go up there. So one, you have to shrink that monster. The second thing is you always have to develop a tough skin using those, like we said, the cognitive behavioral therapy. You have to challenge those thoughts that I'm not good enough to be up there, and say I am good enough to be up here, and therefore I'm going to do what I can. So mind over matter, as well as shrinking that monster, and of course practice. Before you actually have to do your public speaking, you have to do a lot of practice. A person in a wheelchair has those issues and the judgment of, wow, I am in a wheelchair, and am I different? And society is somewhat times cruel, and you have to learn some level of being a tough skin, and to ignore those butt heads and assholes out there sometimes. Excuse my language. So, okay. And another question?
How do you help your partner understand your anxiety?
That's a great one. If it's someone that's really close to you, they can already sense that you have anxiety going. The question is are you looking to have them help you with your anxiety? Can you, as a person who has the anxiety, reach out? And one of the things I think you need is communicate what's bothering you. They may not know exactly what really is upsetting you. So if you're the person with the anxiety, and you need to take a minute and say, hey, honey, this is what I'm thinking. These are some of my thoughts. And some of those thoughts are like myself. Sometimes they're so crazy out there. And your partner who loves you will calm you down, tell you that they love you. And just doing that is some way peaceful and supportive. Now, if you're on the other side, that you are the partner and you don't have the anxiety, and what can you do about someone who has anxiety? It's basically love them and cherish them for who they are, and to allow them to feel the anxiety and say, look, it's normal. I don't know what you're going through. I don't know how that bothers you, but I am here for you, and that I'll do whatever I can. Sometimes it's just making them a cup of tea or a gentle back rub, to say that, hey, I'm here, I'm with you, and whatever you're going to go through, I'm going to go through it with you. So depending on which side of the fence you're talking about. So, okay. Another question.
I think we have time for one more question.
Okay.
Do you think the generalized anxiety disorder worksheet that doctors give patients to fill out are an accurate assessment of someone's anxiety?
That is an incredible question. Actually, it's a great question. And the answer is no. What happens is, depending on the scale, in some literature I've seen where the scale will diagnose someone with anxiety about 13 to 18%. And then depends on the scale, others will give you another scale, and the anxiety would be 40%. The answer for me, I think it's yes. It's nice to be able to say, okay, you meet the criteria based on this scale. If you don't meet, the point is, does your anxiety impact your quality of life? Does your anxiety impact your daily life? If it impacts how you function every day, then you need to have it addressed, irrelevant if those scales work or not. And that's my opinion. Is that what's more critical is that, does it impact your daily life? So great. We are at 3 o'clock. I am so grateful that you gave me an opportunity to talk about anxiety post-injury. And I hope you had a somewhat of good time today in learning about this, and I hope you come back next time in our November podcast. I'm grateful to have you come on today. Thank you, Kelly. Thank you, Foundation, for another opportunity. I hope you have a great day.